A record 530,000 people are now on waiting lists, according to the latest figures from hospitals. This includes, by the way, 39,000 people who've been waiting for an appointment for more than 15 months, which is the figure set by the government as the maximum figure beyond which nobody should have to wait. And of course there have been promises to reduce overcrowding and a planned reintroduction of the National Treatment Purchase Fund to try and reduce waiting lists by bringing in private treatment for some public patients. We're joined to discuss this by Health Minister Simon Harrison. Minister, good morning.
Good morning, Carl.
And thanks for coming in. And just to give us all an idea of what it's like to be on a waiting list and not knowing when you're going to get off it. We spoke last night to Teresa Murray, whose 15-year-old daughter Maeve, who has scoliosis. This is this condition that leads to growing curvature of the spine, particularly distressing for young people, who's been on a waiting list for an operation for this for over 3 years. Ashton Kelly spoke to Maeve and her mother about the issue on the programme, listeners might remember, last January, and she spoke to Teresa again last night, who said that hopes of the surgery taking place have been dashed on a number of occasions.
Well, we were told 3 years ago that she'd have it that summer. We were private at the time because we had private health insurance, but I discovered then that my insurance didn't cover the operation, so we went on the public list. And then we were supposed to get it last summer, and it didn't happen, and it hasn't happened again this summer.
How difficult is it for Maeve living with scoliosis, Teresa? How's it affecting her quality of life?
Maeve feels as if her life is on hold. She knows that this surgery is going to be a huge deal. It's an extremely difficult surgery. And, she's just finished her junior cert, so she would have been studying, like any normal junior cert student. She'd have been studying 9 to 4 in school and then a couple of hours after school. And she found that extremely difficult because she wasn't able to sit for long periods without getting pain. And I would say about maybe once a week I'd get a call to come and collect her, and she'd come home and take a rest from us.
What have doctors told you? Is it likely that Maeve will get the surgery anytime soon?
I don't know. I'm kind of tired at this stage of hearing it'll be this summer, and this is the third summer now. It's nearly over and she still hasn't got it. And like I said, she's just finished her junior cert. It looks like she could be going on the list, the adult list, to have the surgery in Tala as an adult. And, I haven't even investigated to see how long that's going to be. I'm afraid to, because, I could be looking at her doing her leaving cert and still not getting the surgery, and I just can't even think about that.
And what will be the consequences, Teresa, if she doesn't get the surgery sooner rather than later?
Well, it gets worse. The scoliosis isn't going away. It's not something that is going to disappear. It gets worse every year. So, she's just going to get worse.
If you were to speak to Minister Simon Harris, Teresa, what would you say to him?
I'd ask him to tell the government to get their priorities right and start spending money on things that are really important. This is an essential. It's not something that, doesn't have to be done. It's going to have to be done at some stage.
And that's Teresa Murray, whose daughter Maeve, as she was explaining there, has been waiting for a scoliosis operation for over 3 years and still doesn't know when she'll have it. And that's just one condition. As I said, there are 530,000 people now on hospital waiting lists. And as I say, the Minister, Simon Harris, joins us. And we're, of course, not forgetting that you're in the job less than 4 months.
That's okay.
But where do you start?
Well, I think you start with where Teresa finished, which is there's absolutely a need to make sustained investment in waiting list initiatives. I'm going to put my hands up and say I think, and I genuinely believe, it was a significant mistake to deactivate the NTPF, because whatever people's ideology is, I don't think, and I don't know Teresa and her daughter Maeve, but if you're sitting at home today and you're in need of an operation, what you don't want is a big ideological debate about the health service. What you actually want is actions.
That decision was taken by James Riley just over 2 years ago.
Correct, and I'm not correct, and it was a decision taken, and it was taken at the time, and that's absolutely fine. But we now have a situation in relation to waiting lists where we clearly need targeted, funded action actions. And the programme for government is very clear, Cathal. It says in the budget, which is in October, there will be 50 million at least for waiting list initiatives. And of that 50 million, at least 15 million will go to the NTPF. I've met the NTPF. I've told them to gear up and be ready. I've told them to come back to me with proposals. And I've given them a ring-fenced €1 million to get on and do 3,000 endoscopy procedures to begin to rev up. But that's not enough, because what are we going to do this year? What are we going to do in 2016? There's a way to go. We're in August. We have a number of months left in this year. Waiting lists are unacceptably high. I met the HSE on this issue in July, and I asked them to come back to me with an action plan on what every hospital can actually do between now and the end of the year. Remember, we've given our health service an additional €500 million since this government came to office.
And you're giving the HSE less than they asked for to deal with this problem this year. Now the situation has got worse.
No, I don't
Now, 50 million was set aside in the programme for government. Is 50 million, including 15 for the National Treatment Purchase Fund, is that enough in a situation that's got worse, even in the months since the programme for government was signed off?
Well, you see, I don't think your comment that we haven't given the HSE enough is accurate, because for the first,
they asked for more than they got.
But for the first time in recent years, the HSE Director General has been able to say publicly and privately that the HSE is now adequately funded to deliver its service plan, and its service plan has very specific commitments, which you referenced at the start, in relation to waiting times. But what I'm telling you today and this morning on Morning Ireland, I'm announcing specific actions that can be taken between now and the end of the year. Yesterday, I received from the HSE the action plan that I sought, and there are 5 initiatives that can be taken, and I want to put them on the record here this morning. By the end of this year, we'll see a 50% reduction in the number of patients waiting more than 18 months for inpatient procedures. That's about 7,500 people. We've got to start with the people waiting the longest. That's the fairest and equitable way.
How much of a reduction did you say?
We'll see a 50% reduction.
In the, so you're waiting more than 18
correct,
months?
For inpatient procedures. We need to make sure our waiting lists are accurate. We need to make sure people are on them only once. We need to make sure people are on them in the right places. We need to make sure that people are clinically validated, so those who need a procedure are getting it quickest. By the end of this month, a clinical validation of all of the inpatient waiting list will be carried out. This will make sure we have accurate lists. We'll also make sure we have chronological scheduling, so people waiting the longest.
What does a clinical valuation mean?
Well, a clinical validation means that the doctor, because it shouldn't be bureaucrats or ministers making decisions, that the doctors will actually look at the files and check, yes, that person needs the procedure, actually, geez, that person needs a procedure quicker, and they will make sure that the list is accurate and chronologically scheduled. So
everybody's file, if you're waiting, everybody's file will have been looked at, that's all. It doesn't mean you'll be seen.
No, but you will make sure that we have an accurate list and that people are scheduled in a chronological order. The third element of the action plan that I'm announcing this morning is that the special delivery unit, you'll remember this was established to go in and work with hospitals, that will be asked to oversee the implementation of a waiting list improvement plan. So every hospital group has been asked to come up with a waiting list improvement plan. What can your hospital do? Remember, we've grouped hospitals now. So some hospitals are really good at dealing with emergencies, at dealing with traumas, at dealing with car crashes and heart attacks. Other smaller hospitals might be able to do more day case procedures. So all of the hospital groups have had to come up with an improvement plan.
Now have that.
And we now have that, and the special delivery unit will be visiting all the hospitals and will be making sure it's delivered on. The fourth point in the plan, I've asked that the SDU will appoint for each hospital group...
Sorry, the SDU?
Sorry, the Special Delivery Unit, my apologies, will appoint an improvement lead, a person specifically responsible for tackling waiting lists, to make sure that all of our hospitals that are grouped and networked together are carrying out the maximum amount of procedures possible. And the last element is I've asked the HSE by the end of this month to come back to me and see if there's any specific waiting list proposals that they could have for this year. You'll remember, as I said, we've allocated an extra €500 million. Is there any of that should be ring-fenced for specific waiting list initiatives? So when you take this with the plan for 50 million in the budget in October, 15 million for the NTPF, the reactivation of the NTPF, and also the last point I'd make is we've seen problems in terms of inpatient access. If you have people in our hospitals that delayed discharges, people that could be home in the community if there was a home help package, but they're taking up a bed in hospital that they don't want to take up and they don't need, we're now seeing 40 million gone into home help, so get people out of hospital quicker where they want to be, back home.
Is that 40 million extra?
Yes, it is. It was part of the 500
million. And the 50 million, is that being spent this year?
No, this is the point.
So nothing extra is being spent this year, even though the situation is getting worse, as we literally every time we hear about the lists.
No, it's two-pronged. Well, it's at least two-pronged. 50 million in the budget from 2017 onwards. We'll see very concerted, well-funded waiting list initiatives that we haven't seen in years. But what can we do between now and the budget? And what I'm telling you is these are the 5 actions that I believe we can take now. We have given our hospitals more. This is no longer a question of asking hospitals to do more with less. This is now asking our hospitals to do more with more.
You're only on the job 4 months, so you can only expect so much. If you were to come back in a year's time, what would you like to have achieved at minimum in terms of these waiting lists that are getting worse at the moment?
Well, I think the 15-month target, which hasn't been met, needs to be met. 60% of our patients in this country, and this is important to set context, 60% of patients are having an appointment or a procedure with a waiting time of 6 months or less. 91% of people are having it with 15 months or less. Our hospitals are doing more. 27,000 more operations have been done so far this year in our hospitals than last year. But I want to see continued improvements in that. What I particularly,
everybody wants continued improvements.
No,
what I'm asking is this:
yes,
apart from the people waiting more than 15 months, which is a target set by the government, not achieved in the case of 39,000
not
people.
achieved in 9% of cases.
Okay. Okay, but in a year's time, apart from the 15-month target, in terms of these more than 500,000 people on these lists, what would you like at minimum to come in here and say, well, we've done this much in a year's time?
I don't want to be hearing stories like Maeve's. I don't want to have a situation whereby...
overall, big picture.
No, that is big picture.
I'm not asking about individual. I'm asking about
people.
Over 500,000 people. What would you realistically, at this stage, at minimum, like to achieve in a year's time?
Well, what I want to be able to tell you this time next year is that the NTPF is carrying out thousands of procedures that it hasn't been carrying out since 2011. I want to tell you that we have 50 million going into specific areas that our clinicians are telling us.
You don't want to commit yourself to any minimum figure, is that right?
I'm not going to put a number on it because, and I'll tell you why. Last year, 75,000 people a month were being referred for outpatient appointments. That's now 85,000 people a month. I'm not going to give you an arbitrary figure today. What I'm going to give you is a plan and a vision, and I'm going to give you a funded way of doing it. We now have an action plan for our waiting list for this year, and we have a funded plan for next year. I'm going to bring a degree of political leadership and oversight to this that has been missing, and that is now needed. We are now, thankfully, in a position where I can preside over a period of reinvestment in health, but that needs to be accompanied by action and results. I don't want people to think, though, that our hospitals aren't doing work. Our hospitals are working extraordinarily hard, but demand is massively incing. We've seen it in our EDs,
and, that's
and we've got more to do.
Just a final point, just in relation to the waiting lists. Do you think that... I mean, this is a situation which is getting worse. Now... I know there's a limit to the amount of money available. If the situation is getting worse, even since this extra 50 million was committed, that would suggest, wouldn't it, that you're going to need a bit more money to deal with this problem.
Well, I don't.
Do you need a bit more money?
I don't think my colleagues would appreciate me negotiating the budget on the airwaves.
Well, don't negotiate, but in principle, do you need some more if it's getting worse?
What I need to make sure is that the health service is adequately funded. Since I've come to office, the Director General of the HSE has been able to say publicly and privately that he now believes the health service is adequately funded to deliver the service plan. I need to make sure we put a service plan in place for next year that allows Tony O'Brien to say the exact same thing. We haven't had €50 million ring-fenced for waiting list initiatives each year in the lifetime of a government. We will now have it in the lifetime of this government. All
right. Just a couple of other things which I know are on your agenda at the moment. One of them I see from the Independent that you're going to announce tomorrow. Standards with the HSE, standards for bereavement care following pregnancy, loss and perinatal death document or protocol for the health service, and obviously with fatal fetal abnormalities on everybody's mind because of recent debates in the Dáil and recent events, including speeches made by our own colleagues.
Yes.
What's this document going to achieve in terms of people who face this awful situation?
I'm looking forward to launching these standards tomorrow. This will be a national standard, so no matter whether you're a mother bereaved or a father bereaved in Roscommon or Donegal or Wicklow or Cork, that there are national standards right throughout the country in terms of what you should expect from your health service. I think that's very important. I've heard many anecdotal cases of different people in different parts of the country receiving a different level of service. So I think to have national standards that aren't just medical standards that you or I can pick up as members of the public is important. The point you make about fatal fetal abnormalities is also important. It is not correct to say that women and indeed parents who have experienced fatal fetal abnormality should not expect to receive support. They always should have had an expectation that they could receive the same bereavement support as anybody else. But I'm very concerned by the fact when I read the Amanda Mellish judgment from the UN, a woman who had a termination after a fatal fetal abnormality in the UK, and the UN said very clearly that when Miss Mellish returned to Ireland, she didn't receive the level of bereavement counselling and support that other women would have and that she should have. What this document will do tomorrow is very clearly list that all of the conditions that bereaved parents include fatal fetal abnormalities, and I think it's important that that's acknowledged in writing in a HSE publication.
So what happened to Amanda Mellett shouldn't won't happen again?
Well, it never should have happened. That's why I apologised on behalf of the HSE and on behalf of the department to Miss Mellett on the record of the Dáil, and it shouldn't have happened. And I think these standards, and by having it clearly in black and white, will make it less likely to ever happen.
Electronic cigarettes, you're drawing up legislation, I think, to regulate e-cigarettes, but we also read this morning in the Times of a proposal or a document from the Department of Finance looking at the possibility of taxing them. What do you think of the idea of taxing them?
I think it's worth considering. Taxation matters are matters for the Department of Finance. My department, as you said, is drawing up legislation to restrict the sale of e-cigarettes, to not allow them be sold to people under the age of 18, and also to ban the sale of tobacco in general from vending machines and the likes. I think we have a good record in this country on tobacco. I want to see this continue, and I think this is the next step. All taxation issues will be considered in the context of the budget. I note the report in the Irish Times today, but no decision has been made.
All right, finally, we read that you were speaking at the Parnell Summer School yesterday.
'Tis the season.
It's time to think. And you're thinking, and you're not the first politician to have said it. That doesn't mean that it's not worth considering. You're calling for a more polite, more considered, less headline-grabbing discourse by everyone, but by politicians included. Now,
correct.
It sounds a bit preachy, with respect.
That's okay.
And you're not the first person to have said it, and then promptly within a couple of weeks you grab headlines, because that's what politicians do. So what substantially you're talking about?
I don't think there's a problem with getting headlines. Politicians generally are newsmakers. They're in the news cycle. The public expect to see what they're doing through the media. But I do think we need to have a more respectful, thoughtful debate in Ireland, and that includes politicians. I'm sure it includes me as well. We've had a very interesting debate and discussion here. You've asked me tough questions. I've tried to answer the questions, but we haven't shouted and roared at each other. That's not always the case in radio studios, television studios, or in the Dáil chamber. And I don't think those sort of shouty, screechy debates serve the public well. We see what happens I think in the US, and I referenced this yesterday with the Trump campaign. I think we saw it with Brexit. I think we see it from time to time here. So obviously politicians will always be in the headlines, but it's not our job to grab a headline. Yeah. And I also think the instantaneous communication, I love social media, engaging on Twitter, all of this is great. It makes life very convenient. It's very liberating. But at the same time, the idea that every politician must have an instant response, a knee-jerk reaction to everything. What's wrong with actually saying, and I'm as guilty of this as anybody else, let me think about that and let me come back to you. Actually, I don't have an instant response to that. Actually, I'd like to do a little bit of research on that. I think if we don't do that, I think we run the risk of downgrading debate. And
I'm not disagreeing with any of that, but politicians, I've heard this from politicians for decades.
Well,
and people, and this is the key question that arises, that many politicians before you, and maybe you'll agree, have said to me, I want to do something. I want discourse to be sensible, intelligent, enlightened. I want us to talk about things that will really change people's lives in a considered way. But at the same time, if I say something rude, or if I, give out in a really intemperate way about somebody, I know that'll grab headlines. And isn't that just the way of the world?
I think it's a fair point, and I think we all have a responsibility to reflect on that, media included. And I think new politics, and I know people look at it in different ways. I've certainly noticed, I was in the last Dáil and I'm in this Dáil, I've noticed the tone of debate improving in this Dáil, because nobody has an overwhelming majority, or any majority in any sense, government or opposition, so you have to try and win the argument, you have to try and persuade people. That's different. That's a real culture shock to our political system, but it's not necessarily a bad thing.
And of course the test of new politics is not what's said in the Dáil, but what happens as a result.
Absolutely, and I'm happy to be judged on that.
We'll see. We'll talk to you in a year's time, and I hope many times in the meantime. But Simon Harris, thank you very much, Minister for Health, for coming in to talk to us.